Excellent. Very much in order.
Okay.
Hello, Ronald from Helena.
Hi.
How are things over there today?
It's incredibly busy. Oh my word. We've got a lot, like the floodgates have just opened up, a lot's going on. But I'm going to turn off my video. I just wanted to turn it on for identification purposes so that you knew that I was on the call, but just out of respect of the chamber, I'm going to turn it off.
Fully understand we have a good sound check.
But I'm still here. And yeah, it's gotten incredibly busy. And then Joe, I sent you a email with some bills that had been read across the rostrum for first reading and assigned to committee so that you can take a look at those bills.
I heard action was taken on 121 today, was it not?
I have not
think so.
seen the standing committee report. I'm not in any of the individual committees, so I get the standing committee report as soon as they're reported out. If I paid attention to every one of the committees, I think I would probably lose my mind.
If you had to provide testimony to some of the committees, you might lose your mind.
Hey, but remember, I take the minutes for the House floor, so I think I still might lose my mind.
Yeah, absolutely.
And we didn't greet Roger. I see him there. And
Hey guys.
I see Andy Viano of the famous Beacon. I don't know Julie. There are several Julies in my pen pal group. There's Dr. Annie. Pam, do we have good audio with you?
Hey, Pam, are you out there? Turn your audio on your Zoom.
Is that better?
Yep, got it.
There we go.
Carrie, I count 6. Can you confirm that?
Yes, we're still missing 3.
Okay. And do we have any indication that they may not attend?
Joe, have you heard from Highbauer, Larson, or Waterman?
I believe they all attend. I haven't communicated with only one of them. 2 of them are going to be here.
I had a talk with Artis. She's got a previous commitment, so she will not be here.
Okay.
I don't know about the other 2.
Professorial privilege was 10 minutes and then the class started, but let's cut that in half and say maybe we'll give them 5 minutes. Anybody have any good jokes?
And Joe, I have a message. Oh, it looks like Kyle is joining right now. That's funny. Just got a message about him.
Who's
There he is, number 7.
I would give Pete a few more minutes. I know he wants to be on.
Yeah, we do that for the doctors. They have pretty busy schedules. Drop your stethoscope and go to a Zoom call. Joe, in this time, can you give us a little briefing on the inoculations last week? There are a lot of people on the call that probably have not heard anything about what we did or what we did yesterday, and just bring us up to date. You got your sound?
We were kind of burning up our Moderna vaccine. We had a smaller clinic on Tuesday. We received 975 doses of Pfizer for this week, Thursday and Tuesday next week. So we're ramping up quite a bit. We had a little trouble with scheduling. So I think we're probably, I'm just going to guess, we're probably around 550 vaccines for tomorrow. And good number, but it's taken this is our first rollover to Pfizer vaccine, which, as everyone knows, it takes that ultra cold storage, handles a little different. So we have 2 pharmacists from KRH that are coming down to help us reconstitute and draw, which is going to be really good. And have several vaccinators, RNs from Kalispell Regional also. The only other thing I'd mention is the numbers in the paper the other day were not accurate. We had, as of the beginning of this week, we had done 5640 in vaccines, which puts us right in the same area as everyone else except for Missoula and Billings. So we're basically doing quite well. Tomorrow starts our big ramp up. Probably at least 580 doses first doses at least 2 times a week. And then after 3 weeks, then we're going to start filling in with the second doses, another 585. So, or another 1170, excuse me, total for the week. So things are going to get ramping up pretty fast.
Okay, good. I see Dr. Pete's with us. Get a radio check, Pete. Oh, good. Harry, our 5 minutes, and I think everybody's here that's going to be here. So we'll call it to order at 35 minutes after the hour. Would you call the roll, please?
Berg,
I am here.
Bukacek,
Here.
Highbar,
Here.
Holmquist. I can see you, even if I can't hear you.
Here. There you go.
Larson is not here. Malberg, Fiftal.
Yep.
Noble,
Present.
Skis,
Here.
Waterman.
Here.
All right.
Okay, we have 8 out of 9. First thing I want to do is welcome our new member, Jessica. Jessica, could you spend a moment or two telling us about yourself and how you had to make an application to this august group?
Yes, absolutely. So my name is Dr. Jessica Malberg-Fiftal. I'm a veterinary radiologist with a Master of Science in Public Health. I grew up in the Valley, started school. It feels like my family always makes fun of me because I went to school for my whole life, but I started school at Fairmont Egan, and then I spent my junior high year at Flathead Valley Christian School, which is now I think Stillwater Christian School. And then I went to Flathead High School where I graduated in 2000. I then went on to Montana State University where I started to become interested in veterinary medicine, population health, and communicable disease. So I had many wonderful experiences and research during my undergrad years, including working at the State Fish Wildlife Lab, where I was able to participate in chronic wasting disease testing, including removing the obex and medial retropharyngeal lymph nodes from a lot of heads that were surrendered by hunters. And that really cemented my love for interest in veterinary medicine and infectious diseases. So I graduated with my bachelor's of science in biology with an emphasis in fish wildlife management. And then I went on to complete the pre-vet curriculum as well. And I applied to the combined Master's of Science in Public Health and Doctorate of Veterinary Medicine program through Colorado State University. So I spent 2 years at the University of Colorado at their medical campus. During this time, I was part of the Master's of Science in Public Health program, and many of my colleagues were MDs as this program was created for them. So we did a lot of human medicine studying, and in addition to the principles of epidemiology and biostatistics, etc. While I was living in Denver, I had the good fortune, I guess you might say, of they were undergoing a plague epizootic at that time. So there was Yersinia pestis spreading throughout the rodent population. I was able to work on research with this with the Colorado Health Department, and I was able to present my research at the 33rd Annual Zoonosis Conference in Denver, as well as publish a paper on the effectiveness of their surveillance techniques in the peer-reviewed Journal of Zoonosis and Public Health. So I went on after that to people really privileged to attend veterinary medical school at Colorado State, which is one of the best colleges in the country for teaching. And I graduated with veterinary medicine after postdoctoral training in animal medicine involving many different specialties. And then once I finished small animal rotating internship, which is what field, I also was able to work with, can you guys hear me? My internet connection is unstable, so able to work. Frozen? Can you hear me? Sorry. Okay, I don't know where I left off. I saw you guys freeze and it said my.
I think you managed to convince us that you raised our average IQ by about 15 points.
No, but I just, so I've worked with multiple shelter organizations, and I also then did a residency in diagnostic imaging. So I currently work in telemedicine. So I am a veterinary radiologist. So when people take images like x-rays, CTs, MRs of veterinary patients, they're sent to me and I read them.
And where is your practice headquartered? I've read that you're from Whitefish. Where do you actually do your work?
I do my work in Whitefish, so I work from my house.
Okay.
I would love to establish a small diagnostic imaging clinic here to help support the Valley, but I was able, thankfully, which had always been my goal, to come home. I was able to move home about 1.5 years ago, and then that was right before the current pandemic hit, which is not the best time for establishing a practice. So I've just been working remotely from my house.
Well, thank you. Joe, you had a few comments you wanted to make about.
Bill, I think we probably should, there's a few people that have signed up to do public comment, and then I would probably open it up to discussion on the policy.
Okay. Well, Carrie, then back to you for the public comments.
So we had 2 people sign up for public comment. Only one of them is logged in. So Thomas Millett, it is your turn to give public comment.
Hello, can you hear me fine?
Yes, we can hear you.
Okay, thank you. My name is Tom Millett. I'm from Marion, Montana. And I just want to go on the record and oppose this in-person meeting policy that's currently under consideration. And the reason being is there's already a statewide directive that's already enforced. So why are we doing this? Now, I think I know why you're doing it, because if your intent is to have a face covering policy to pick up where the statewide directive goes away, because eventually the governor will do that, then why don't you just simply state that in your policy? The problem with this policy is, even if it was enforced as is, it's very confusing. For example, in the beginning of the policy, it talks about the governor's statewide directive, and it includes medical exemptions. But then when you get down to the end where it says your protocols, it says nothing about the medical exemption. So that leaves someone to wonder, well, if I go to a meeting at the health board for the health board, am I exempt or not? You know, it's very unclear on that point. It's almost like the IRS wrote this policy. So if you want to really see what a policy looks like in the Valley, that's kind of seamless and it does what I think that you're trying to do, take a look at the emergency ordinance that the city of Whitefish passed back in January 4th. It's a emergency ordinance 2101. Their wording is very clear, it's concise. Although I don't agree with their policy, that it is a well-written policy. And it's very, very clear on what your requirements are and when it picks up and when it terminates. And that brings me to another point. So if you're going to go forward with this policy, I really ask that you do two things. The first thing would be to define that a mask and a face covering includes a face shield. It doesn't say anything like that. And we do have people in our community that have difficulty wearing a mask. It obstructs their breathing, so they would really prefer a face shield. If you could delineate that in your policy, that'd be great. Another thing that concerns me about this policy is there's no termination date. It basically says, quote, this policy will remain in effect in its entirety until modified or rescinded. Now, here's the problem. If you don't have a termination date, anyone, even a government entity, they usually take that as, well, I can just leave it go, and it's going to run wild. And that's exactly what we don't want to happen. We don't want a policy that's indefinitely in effect. So or you could have either a termination date or a review by date, like 30, 60, 90 days. That would be fine, because that would force the board to revisit the policy in the future so that it would prevent the policy from becoming permanent on its own. So just to sum up real quick, 4 points. I oppose it because there's already a statewide directive in effect. If you're going to keep this, I highly recommend you take a look at that emergency ordinance 2101 that Whitefish has. It's well written. You could learn something from it. If you're going to keep this one, make two changes. The face covering includes a face shield, and put a termination date or a time when you're going to review it again. That's all the comments that I have. Thank you for serving the community, and thank you for allowing me to make comments. Have a great day.
Thank you, Thomas. Is our missing speaker, has that person materialized?
No, the other person has not joined in. So that is the end of verbal public comment. And the written public comment submitted before 1 p.m. today was uploaded to the agenda. So any of the board members can review it there.
And they'll find that at the website, correct?
Yes.
Okay. Joe, do you want to add? I thought those are a couple of good comments. Do you have anything to add?
Yes, Bill, just real quickly, I just want to go through that. I've been approached by many board members with a desire to move forward with some in-person meetings. To that end, this is more than a mask use protocol. It's actually a social distancing protocol. So that's also part of it. But I want to go through just a few things. These would be friendly amendments on what I have written. And a lot of them are based, if not all of them are based on my discussion with the county attorney's office. So Bill, if you don't mind, I want to, if everyone has the policy in front of them, I want to go through a few things that the county attorney's office thought would be appropriate. So we can shorten the background quite a bit by on line 6. Oh, thanks, Carrie.
Carrie's putting it up on the screen right now.
Yep. So I'll just keep moving on. Line 6, it states the board recognizes that section from that line 6 to line 23 could be removed. And it may be better if I don't go through the whole thing and then ask for it, just so you understand. This is information that is most likely unnecessary to the background. The background is the board desires to establish protocols necessary to protect the board, staff of the city county health department, and members of the public during in-person meetings. So that would be the only thing left, down to where it states, as of the date of this policy, Governor Gianforte's executive order states. So that would be the next paragraph. So Bill, I'll leave that up to you to open that up for for a motion and discussion.
Let's start with a general discussion before we get to the motion. So I
Okay,
assume everybody's read the policy and protocols, and this applies only to our meetings. Is that correct?
it only applies to Board of Health meetings.
Okay.
Or meetings of the Board of Health, maybe a better way to put it.
Okay, and it's the meetings of the full board, which we have today.
The way it's written, that would be its intent.
If I may pop in here with a little discussion.
Please.
I totally agree with that. I've looked at it and I believe that particular section is a little redundant because there are specifics brought up under policies and protocols that pretty much cover everything that's in that paragraph. So I don't believe that paragraph is needed, what he just stated there. So I support that. And I can make a motion unless there's other discussion.
Let's hold those till we get to the end and let's see what all the comments are. I simply had a comment. I liked Thomas's suggestion that face shields would be appropriate.
So
If I
Bill,
may
I've
jump in here
actually,
just a minute, Bill,
Pardon me?
if I may jump in just a minute.
Oh yeah, go ahead, please.
I think it would be easier as we go through these to either motion them separately. It's a little hard to motion them all at once, is what I'm getting at, depending on how many we have. If every